am on fire. All right, so let's play the video so people can hear.
Americans across the country are struggling to find physicians. In fact, one estimate projects a shortage of up to 48,000 primary care doctors in the U.S. by 2034. Ann Thompson now on what's driving it.
See you in a little bit.
Dr. Terry Vester, 68 years old, is still working as a primary care physician in rural Lafayette, Alabama, the only one within a 30-minute drive.
There have been doctors that come through here, but they don't stay.
In New York City, where there are 4 times as many doctors as the entire state of Alabama, Olga Torres lost her primary care physician to concierge medicine 2 years ago.
I could go see him at this concierge practice for $10,000 a year.
Have you been looking for a primary care physician?
I have.
And have you found one?
I have not.
Unable to find one taking new patients, today Torres says her cardiologist fills that role.
This is not what she should be doing.
Across America, primary care doctors are increasingly hard to find.
My own parents had the same issue in Jacksonville, Florida.
Dr. Jesse Ehrenfeld leads the American Medical Association.
Why is that shortage so acute today?
Well, the problem is the number of physicians in the U.S. is just not growing fast enough.
The AMA says it takes 10 years to educate and train a physician while the population grows and ages.
We know that health outcomes are worse when people don't have access to primary care. They live shorter lives and they live sicker lives.
The AMA says more federal funding is needed to increase training slots. The average.
Okay, you guys heard it, so let's talk about it. This is what's gonna be one of the issue I am largely trying to address. Okay, so first let me introduce myself. If this is your first time seeing me on any of my platforms, whether you're watching me on YouTube or I'm streaming live on Instagram and Facebook, I am Dr. Jennifer Genty. I am a functional medicine, holistic medicine doctor, and I love helping my patients heal the bodies naturally. First, we identify the root cause so that we can have a better understanding of what's going on in the bodies to address the symptoms at the cellular level, at the root level. I am a firm believer there are multiple options, multiple ways for you to heal your body. It doesn't require a pill all the time, although you can take a medication. There's a place for medication as well if that's what you choose to do. But my goal is to really help you see all the options you have out there so that you know what is the best fit for you, what you are into alignment with. Now, as you guys heard at the beginning of this stream live, that there's a huge shortage of primary care doctors, and I have to tell you that shortage continues to increase. And as NBC News reported, that shortage will be threefold by the end of next year, according to NBC News, right? And I want to talk to you guys about how this shortage is gonna negatively affect your life, because if you know me by now, you know that I am a big believer that your health is the number one asset. You don't have your health, you don't have anything else. Whether you're trying to, create more freedom in your life so that you can spend time with your family, spend time with your loved ones, you're trying to travel, you're trying to feel your best so you can have the energy, the cognitive function, so you can have the motivation, so you can address your hormone imbalance, so you can lose weight, so you can tackle your diabetes, so you can tackle your high blood pressure. You really need to address your health at the cellular level. And having a primary care shortage, right, is significant for us. Because what do we do when we have symptoms? The first signs of symptoms, we just go to our primary care doctor, right? Because not only they take insurance, but you don't know what's going on. You need someone to take a look at you. You need someone to really assess and evaluate you so that you know if the symptoms you're experiencing are worse or is it something that you can treat easily. However, there's a shortage. There's not enough primary care doctor out there. It's not my words, although I've been talking to my patients about that. All the patients have been reaching out to us, letting me know that Dr. J, I cannot get into my doctor. There's a long waiting, right? Like there's a long wait for me to get into my doctors. So, but now that the news, the news media is actually talking about it, it's becoming more problem. And as I've been thinking about this and I've been communicating with my patients about this, because they're reaching out to us, wanted to see that if I can become the primary care doctor, and I've been doing my research and I've been talking to other colleagues of mine and to see what is going on out there in the world of medicine, I'm seeing there's a huge gap, right? And this gap will not only affect you, this shortage will also affect your loved ones, your children, your spouse, your family, even your neighbor. Everybody's been affected right now because of this shortage of primary care doctors or providers out there. Not just primary care, like cardiologists, there's a shortage, neurologists, there's a shortage, like whatever doctor you're trying to get help, hired to help you with your symptoms, there's a shortage. What are we supposed to do? So this is what's gonna happen. This is the trend. People are gonna continue getting sicker and sicker and sicker and sicker. People are put in because they are getting sicker, they're not getting the proper treatment or the treatment at the right time. They will find themselves put in at risk for cancer, right? Autoimmune conditions, tumors and masses and cysts, and it's gonna create the room for inflammation to take place, a room for disease and dysfunction to even manifest on a larger scale when you have those issues. That's what's gonna happen. If we are being honest with ourselves, right? We are being realistic and we are opening our eyes. We see that this is a sick world that we live in. And the fact that the news media is reporting there's a shortage, people are not getting into the doctors fast enough. They're not getting the proper assessment fast enough. So therefore, this disease, something that could have been treated easily in a short period of time, will be treated, will have difficulties with treatments, right? Will be more chronic. An acute state of disease can become chronic in a short period of time. Why? Because we cannot get in to see our doctors. Now, you might ask, why do we have a primary care shortage, right? A patient asks me, like, well, Dr. J, why do you have a primary care shortage? I'm like, well, besides the world is sick, right? This disease out there, viruses out there, there's always something out there. We live in a stressful world. We're all stressed out. There's stress everywhere we look, right? We're not getting the proper guidance and treatments, and we're not being led properly by our government system, if you were to ask me. But another thing is that our doctors are burnt out. Our doctors, primary care doctors, are overwhelmed. Our doctors, they are getting sick themselves. The same symptoms you're experiencing, your doctors might be experiencing the same symptoms. The same medications you're taking right now for your blood pressure, for your diabetes, for your autoimmune condition, for your cancer, for your digestive issues, your doctors are also taking those medications. Why? Because they are faced with stressful situation in their own practice. I can attest to that because I myself, when I was used to practice in the conventional world, I was seeing 30 people in one day. 30. Do you know what kind of care I can provide in seeing 30 people in one day? Do you know the quality of the care I was providing in seeing 30 people in one day? Because people keep coming, and there's not enough people to support them. There's not enough practitioners to deal with them. There's not enough practitioners to care for them. So therefore, we have to shorten our visit. We have to shorten. Now instead of you getting 30 minutes or 45 minutes, you're getting 15, and now you're getting 5. And then at one point, the nurse used to go in and get the patient ready, and then I just go in and just hand the script. What's wrong with you? You have diabetes, here's metformin. You have high blood pressure, here's a blood pressure medication. Like, I'm literally spending 5 minutes with the patient. 5. So therefore, I don't know who that person is, right? I have no personal relationship with that person. I'm not connecting with that person. I don't know what their stories are. Like, I could literally, if I had enough time to sit down and talk to them and to ask them the right questions, then maybe I would understand what is going on at the cellular level. When it comes to identify the root cause, I had no time to do that. There's no identification of root causes in primary care. There's in conventional care. There's none. Because that requires a longer visit, which doctors don't have time right now, because the demand is so high. People are getting sick and sick and sick and sick and sick and sick. And because they're getting sicker, they are not, they're not getting the proper treatment, or the visits getting shorter. They remain sick and sick and sick and sick. Do you guys understand what's going on? It's like, I'm sick. I have a stomach issue. So let's take acid reflux for example, right? I have acid reflux. I go to my primary care doctor. My primary care doctor spends maybe, let's say 15 minutes, right? It's first office visit. I, go, sit for like, 30 minutes in the waiting area, right? Because we know in conventional space, the time that you schedule your appointment, the visit, is not the time you're gonna be seen. You gotta sit in that waiting room for a while. Then you go see your doctor. When you go in, the nurse brings you in, they're checking your vital signs, they're getting, prepping you to see your doctor, depending on the office, settings, maybe the nurse will give you a gown to put on, maybe they'll give you a cup to provide some urine samples. So they have like a preliminary process that has to take place before the doctor comes in. And the doctor comes in and you say, well, doctor, the doctor's reading out your chart. Okay, so I see that you have acid reflux, you have pain, when you eat, it's burning, your throat, and you get in the bloat and the gas or whatever. So like the proper question is not being asked, right? So therefore, when I'm looking at your chart and you have acid reflux, I already know what I'm gonna give you is Nexium. I already know what I'm giving you is omeprazole, pantoprazole. I already know it's a medication I'm going to hand over to you. So when I walk into that room, I'm looking at the chart and you're telling me, what's going on. I already, in my head as a doctor, and this is honest truth. If you're a doctor, you're watching this, you know what I'm talking about. You know what I'm talking about. I already know that I have 3 other people waiting for me. So therefore, your acid reflux, your stomach issues that you face with, I already have a solution for you, well, I call it a solution, but which is the medication. I'm gonna hand you a script. And then what you say, doctor, I don't wanna take a medication. And there's nothing else I can do for you, because again, I have 8 hours or 10 hours in that day, and my demand, I'm in demand, the demand is so high. I have other people that are sick out there waiting for me. So I just force you. Or if you come back, I give you the pill, you come back, then the next thing for me to do is to refer you out. Let's refer you to the GI doctor so you can do endoscopy. And when you go do the endoscopy and the results came back negative, right, like everything is normal, you still get a pill, handed you a pill. Because in the imaging, the endoscopy, on the scope, we're not seeing anything significant, but yet you're in distress, you're in pain, you are hurting. So that's primary care. And the fact that people keep going to the doctors, they're asking for a solution, they're asking for answers, they don't feel well, they need help. Our demand is so high, so there's not enough doctors to address your symptoms, to help you address your symptoms. And what's gonna happen? Stomach cancer, right? Liver cancer. Like you're gonna have an autoimmune, you're gonna have colitis, you're gonna have Crohn's, like your acute symptoms that could have been treated if we had enough support for you, enough help, became such a long, drawn out process where now you find that you're on a roller coaster seeing a zillion doctors. So there's a primary care shortage. And you guys will really need to look into this, right? There are a few things you can do so that you can not only help yourself but also help your doctor. And I tell my patients all the time, the power of healing is in your hands. Only you can heal yourself. And I say that people will get mad. They'll be like, oh, what do you mean? Like my specific symptoms or my disease or my illness is so severe that, there's no cure and there's no treatment, and the doctors think I'm a mystery, or the best expert in the whatever state you live in told me that there's nothing wrong with me. Like my case is so severe. When in fact, you weren't born with these symptoms, right? Like you acquired these things throughout life. You acquire these things from eating the food we eating, from drinking the water, from breathing the air that are contaminated. So what is it that you need to do? And I understand when we're in pain, we panic, right? We get anxious because we don't know what's going on. We get anxious, we panic, we don't know what's going on. But you do know what's going on. There's so many things you can do to get you over on the other end. You can start by listening to your body. Yes. If you have stomach issues, you're in pain, take whatever you need to take to make you stable, and do whatever you need to do to really support your body to decrease the stress and the pain that your body's facing. I am all for medications for 2-3 days, for a week max. Good morning, Shirley. Good morning, Pat. I am all for that, right? But in order for you to prevent the same thing from happening again, once you feel better, once your pain is decreased, you must go back to what you did prior to having the pain. Because this primary care shortage, this primary care doctor shortage, right? At the beginning, I played the video by the NBC News. Again, this is NBC reporting, it's not me. They said there's a primary care shortage. And I already know there's a primary care shortage. Like if you look at, doctor's offices, when you call, I have a patient right now who has cancer. The primary care, okay, this is the story. Let me tell you the story. This patient was having stomach issues. Stomach pain, and this patient has been stomach pains for, have been having stomach issues for a week, 1 week. Everything she eats or drink hurts, like literally stomach pain. Don't know what happened. Now at one point she couldn't eat or drink because everything hurts. So she went to her doctor's office. First she went to the urgent care. The urgent care said, well, there's nothing wrong with you. Take some Tylenol, follow up with your doctor, right? Because we all go to the urgent care when we're in pain because we need relief right now. So went to her doctor's office. Doctor's office said, well, there's nothing wrong with you. Everything is normal. Let me give you a Mepozole, Pantoprazole. Let me give you whatever. Pepsi, take something. So they gave her something. Still having stomach pain. Went back to the doctor's office. That doctor's doctor that she has a relationship with, so she didn't have to wait, right? Because they know her. They said, okay, you have stomach pain, come in. So the doctor said, well, there's nothing wrong with you. There's nothing else I can do. So I'm going to refer you to a GI doctor. Called her insurance company to find a GI doctor that's, within network, out of network, that takes her insurance. Called the GI doctor, called the office. They have a 3-month wait period. She has to wait for 3 months because that GI doctor is booked. And it is a group practice, not just one doctor, it's a group practice. 3 months, she has to wait 3 months to really get into. So what do you do when you're in pain? You eat, it hurts. You drink, it hurts. Everything you put into your body, you have massive bloating, you have that pressure right here. The Pepsi is not helping, the Nexium is not helping, the whatever Zol is not helping, right? And that patient, I know she is so health conscious, she did not want to take this medication. She did her due diligence while she Googled Nexium, while she Googled Mepozole, and she, according to Dr. Google, you can only supposed to take this thing for 2 weeks. So she's like, okay, I'm gonna do something else. So rapidly, she lost 15 pounds. 15 pounds in 1 month. Abnormal weight loss in 1 month. So then what she did, she said, you know what, I cannot deal with this pain, I'm gonna go into the emergency room. So she literally go to the emergency room. They admitted her. Guess what? She had stomach cancer. Stomach cancer. Now she got out. They did everything they could do for her at the hospital. Now she has to see an oncologist. Out she is. She's still waiting to see an oncologist with stomach cancer. Still waiting. So not only she has so much stress now in her life, it's like, oh my God, I'm in pain. I cannot eat. I'm tired and exhausted. I feel weak. My muscles are going away. Like I don't feel like myself. Now I'm hearing that I have cancer, stomach cancer, and I have to wait months to go see an oncologist. And we all know when we hear the word cancer, it's like fear, right? Like we are fearful, we want results now, so on and so forth. So then she reached out to me. She contacted us. And now we are trying to see if we can get her in, get her some, do some tumor markers, blood tests. So we're doing some things together to see how we can support her while we really navigate, the other options that she has. There is a primary care shortage, and I've known that for decades now. Okay? And it's not because many doctors don't want to provide the best care, because they don't have time to provide the best care for you. It's because they themselves are burnt out and overwhelmed. They themselves are sick, they are stressed out. Doctors are getting sick. Since COVID, doctors were like literally dropping dead. So what do you do? How can you participate in the solution and not be about the problem? There's so many things you can do. First, you gotta take ownership of your health. You got to own that. It is yours to own. It is nobody's health, it's yours. You got to take ownership. What am I doing that's giving me the symptoms that I'm experiencing today? What can I do moving forward to help me decrease my inflammation? Can I detox? Can I manage my stress? Can I do an inventory like Dr. Genty says? Take a look and look at all the things that are not serving me and remove them. Right? Can I improve my sleep? Can I go to the bathroom every day? Can I change my diet? Like literally, if you can find a way to change your eating, because food can either hurt you or help you. And many of us are eating food that are hurting us because we have cravings, right? We give into those cravings because we grew up a certain ways. We all love the SAD diet. And then every time we eat the food, we feel terrible, right? And we just continue. Or we tell ourselves that we don't know what's wrong with us, or we tell ourselves there's nothing else to eat, there's no healthy food out there, or the food is expensive. Like whatever story you're telling yourself, you can literally rewire your brain. Because I am telling you, this shortage is gonna get worse. And my patients are reaching out to me, like literally reaching out to me every single week asking if I can be the primary care doctor. You know how long patients have been asking me? Like I have patients right now that are watching me, they know what I'm saying. And I used to tell my patients, nope, I don't do primary care, I don't do primary care, I don't do primary care. Well, this is changing. I am opening up my door to provide primary care services with a holistic and functional medicine attached to it, if you choose to go that route. That's what's going on right now in my world. Because as I am getting the patients that are at the end of them being sicker and sicker, right? So I can't close my eyes anymore. I have to really do something that can benefit them. All right, so but now we are going through a whole primary care services, mini series, where I'm recording podcasts, and I also have those videos on my YouTube channel, Dr. Jennifer Genty. We can put the YouTube in the comment section below. You can go watch the videos where I am gonna educate you guys how we at the Wellness Corner NJ here in New Jersey, we can also provide telemedicine as well if you don't live in the state of New Jersey, how we can help you not only address your own symptoms, tackle some of your symptoms, take ownership of your own health, how you can participate in helping fixing the shortage of primary care doctors. Because it doesn't make sense for you to wait months to go see a doctor. It doesn't make sense for you to wait weeks to go see a doctor when your body's literally speaking to you, communicating with you, and letting you know something is wrong. Okay? Literally letting you know something is wrong. So I also want to invite you guys, because I know many of you guys gonna have questions like, oh, what is this? Like, how does a functional medicine doctor does provide primary care services? We've been working on this for months now. I've been literally meditating, manifesting, if you're with the woo-woo person that I am, to see how I can incorporate this into helping people and how I can make it affordable. Okay, affordable, that's the word, so that many people can take part of these services. So I am literally creating a movement right now, and I coined this term called confunctional. So tomorrow, I'm gonna come in here live and go over to explain to you guys what confunctional is. Conventional, functional, confunctional. I came up with the term. So I'm gonna tell you how this term came about, what does it mean to you, to your loved ones, how you should care about this, because again, NBC News, I should put the link so you guys can literally watch this whole thing about the shortage of primary care. There's not enough doctors out there to help you. So if there's not enough doctors out there to help you, what's gonna happen? You're gonna be sick, you're gonna remain sick, and then your little tiny disease and health thingy is gonna become like a huge chronic thing where you find yourself on a roller coaster, seeing doctors, being dismissed by doctors because doctors are literally looking for problem areas, right? So if you have stomach issues, you go to your doctor, right? And then we do a scope, nothing is wrong with you, they can't help you. Versus if you have stomach issues, you go to a doctor like myself that provides functional medicine, holistic medicine. We work with you and identify the root cause, because again, I don't think you have time to be walking around to go see doctors for no reason. So if you go to your doctors and say, hey, I don't feel well, I have stomach issues, and I've tried this and I've tried that, or whatever you tell me I've tried, not working, even despite the blood test is saying that there's nothing wrong with you, or the imaging, whatever, workup that they did is showing that everything is normal, but you don't feel good, that's your cue to investigate holistic medicine, natural medicine, functional medicine, because conventional is not going to work for you. So that's why I coined the term confunctional. And tomorrow, which is Tuesday, I'll put I don't know when I'm going to go live because I have patients I got to see. I will go over what it means to be confunctional. Okay? But I also want to invite you into a webinar as well, because I'm hosting a webinar to talk about this. For all of you that are interested, how this will work, do you accept insurance? Like how is this gonna help me, right? You should join the webinar. We're gonna post the link, and also there's no registration. We're gonna post the link and the date, and we're gonna post the information in the comment section below by tomorrow. You should join. You should literally show up. It's February 13th at 6 p.m. So far, that's the date. You should come in. If you know someone that's looking for primary care doctor, confunctional doctor, primary care doctors looking for a new practitioner, one that's actually that will care about them, that's gonna listen to them, that's actually gonna help them look for the root cause of all the symptoms they're experiencing, they need to show up to the webinar. So we put in a webinar together to go over what confunctional looks like, how we are working on addressing the shortage or the gap between primary care or whatever specialist that there's a shortage. Primary care, when I say primary care, I'm talking about all the doctors, right? That's in the primary care conventional umbrella, to functional medicine, how it should actually be and how it used to be. Okay, so you should show up to the webinar, come with your questions, come with your concerns, and we'll talk about all the things from financials. We're gonna have a little piece on insurance, because I think you guys really need to know the game that insurance companies are playing with us, right? There's so many things that many of my patients are not aware of when it comes to insurance. And because you're not aware of them, it's keeping your eyes closed. Because your eyes are closed, you're not really knowing what you need to do in terms of healing your body, in terms of getting the right help for you. So on this webinar that I'm hosting, Marilyn and I are hosting, February 13th at 6 p.m. Eastern Standard Time, is for everybody. Everybody. Specifically, if you're not happy with with the services you're receiving right now, or you're looking for a new primary care doctor, if you're even curious, what is this? How is this gonna work? What? You should show up to the webinar. Because I'm like, confunctional, that's weird. How is primary care? No, how? I asked myself, I'm like, how is this gonna be done? What is she gonna do? You should show up to the webinar, okay? And no, it's not integrative medicine, because I had that question too. It's like, well, Dr. Genty, you mean it's integrative medicine? No, it's not, because integrative medicine don't really focus. They do not focus on identifying the root cause. Integrative medicine doesn't focus on bringing herbs into your treatments, right? Focus on inflammation and toxins. Integrative medicine focuses, still can prescribe as an integrative medicine. It's conventional medicine dabbling in holistic medicine. That's what integrative medicine is. So for all of you guys that are saying, well, nope, that sounds like integrative, it's not. Okay. All right, good. So I'm gonna end this Facebook Live, and I will see you guys tomorrow. I'm gonna go over the term confunctional, the difference between confunctional, my term, integrative medicine, holistic medicine, functional medicine, how you need confunctional in your life if you want to not only heal your body, but not be at the mercy of, you know, doctors that have a long waiting. Okay, so I'm gonna play this video again as we are leaving.
Health alert, more Americans across the country are struggling to find physicians. In fact, one estimate projects us
Not growing fast enough.
The AMA says it takes 10 years to
driving it.
See you in a little bit.
Dr. Terry Vester, 68 years old.
It's a shortage of up to 48,000 primary care doctors in the U.S. by 2034. Ann Thompson now on what's driving it.
See you in a little bit.
Dr. Terry Vester, 68